Okay, so what if you could just turn pain off? Today, we're diving into some pretty groundbreaking new technology that's trying to do exactly that by, well, hacking directly into your nervous system. But before we get into the tech, we have to talk about why it even matters. To really get it, you have to understand the sheer scale of the problem it's trying to solve, the massive global issue of chronic pain. So, just how big is this problem? Well, depending on what country you're in, studies find that anywhere from 12% to a staggering 80% of people are suffering from chronic pain. And look, this isn't just a minor complaint. It's a full-blown crisis that seriously messes with the quality of life for billions of people.
This has kicked off a desperate search for better treatments, especially options that don't involve drugs. Which brings us to a really critical question. What if there was a way to just turn the pain down, without surgery or pills?
And that's where we get to the core idea behind this technology, literally hacking the nervous system. The whole idea is to block pain right at the source, before that signal can ever make it up to your brain.
The fancy scientific term for this is neuromodulation. But really all it is the process of changing your nerve activity, basically rewriting the messages your nerves are sending by delivering electrical signals right to a specific spot. You can think of it like talking directly to your body's own wiring.
So here's how the device in this study actually works. You've got two pads on the skin, and they send these high-frequency signals deep into your tissue. Now, where those two signals cross, they create a low-frequency electric field. This field is basically designed to act like a busy signal for the nerves that transmit pain, effectively blocking their messages from getting through.
Now, you might be thinking, hey, that kind of sounds like a TENS unit, and you're on the right track. But there is a really important difference. Traditional TENS units, they use low-frequency signals that mostly just stimulate the nerves right there at the surface of the skin. This new approach, though, it uses high-frequency signals designed to get past the skin and create that pain-blocking field much, much deeper inside the body. So the big question is, does this new approach actually work? Well, let's take a look at the study which put this exact technology to the test out in the real world.
And this was a big one. Researchers got over 1,500 patients who were all dealing with chronic pain. It's also really important to mention that most of these folks were veterans, a group that unfortunately often deals with very significant and complex pain issues.
Every single person in the study was given one of these, the BioWave home device, to use at home. So this wasn't some sterile lab experiment. It was all about seeing how this therapy worked in the middle of their actual day-to-day lives.
After 2 weeks of using it, the patients filled out a pretty detailed 15-question survey. They reported on everything, from their raw pain levels and how much medication they were using, to how the treatment was affecting daily stuff, like sleeping, walking, and even just standing up.
All right, so after all of that, what did they find? Let's get into the results from this 2-week trial, because honestly, they're pretty striking.
Okay, the headline result was just stunning. The average pain score before treatment was a really high 7.5 out of 10. After just 2 weeks, that number plummeted to around a 4. That is a 46% reduction in pain, which is not only statistically significant, but for these patients, it's potentially life-changing. And it wasn't just about the pain scores. Here's a huge one. A full 42% of patients said they either decreased or completely stopped using their pain meds during the trial. In the search for effective non-opioid solutions, that is a massive number.
But beyond the numbers, how did people actually feel? Well, an overwhelming 87.6% of them reported an improvement in their overall quality of life. The therapy wasn't just turning down the pain, it was helping them live better lives.
And maybe this is the most telling statistic of all. When they were asked if they wanted to keep using the therapy after the trial was over, a massive 97.2% said yes. I mean, that level of satisfaction from patients, it just speaks volumes.
So, what did that improved quality of life actually look like in the real world? Well, almost half the patients said they were sleeping better and were in a better mood. And the functional improvements were just as big. Well over 40% found they could stand for longer periods and walk further. See, this isn't just about feeling less pain. This is about getting your life back.
So yeah, we've seen some incredibly promising results. But as with any scientific study, it is so important to balance all that hope with a clear-eyed look at reality.
The researchers themselves were obviously optimistic. They pointed to the huge scale of the study and concluded that this is a promising, safe, and cost-effective therapy.
But good science always admits its own limits, and it's absolutely crucial to understand the caveats here. For one, this study didn't have a placebo or control group to compare against.
Also, all the data was self-reported, which can sometimes have biases. And finally, 2 weeks isn't really long enough to know the long-term effects, and we need to see if these results hold up in other groups of people too. So what's the next step? The researchers are very clear about this. The next step is to run what are called randomized, placebo-controlled trials. That's the gold standard in research, and it'll really help confirm if these effects are truly from the device and build a much stronger case for this technology.
Which leads us with this final, really powerful question. We've seen a technology that seems to dramatically reduce pain, slash medication use, and boost quality of life, all without an invasive procedure. So we have to ask, could this be the future of drug-free pain management?